Hello everyone. Today we are going to talk about a meta-analysis where we have compared the outcomes of traditional care with the ERAS, that is Enhanced Recovery After Surgery protocol in patients that are admitted for colorectal surgery. The co-authors of this paper are Dr. Hassan Hafiz, Dr. Safia Zahir and Dr. Talat Wasim. So let's begin with discussing about what is ERAS. It is a multimodal protocol to provide patients with a fast recovery after colonic surgery. Secondly, we are going to discuss why do we actually need it. So the principles of ERAS yield a reduced length of hospital stay, a rapid return of gut mobility and function, and a lesser incidence of post-op complications and readmissions. And thirdly, what are the components of ERAS? It includes pre-op counseling, early rehabilitation, electrolyte therapy, bowel preparation, anesthesia, analgesia, and perioperative nutritional care and prevention of the complications. So we are going to discuss why do we actually need another meta-analysis. A lot of meta-analysis have already been published on this particular topic. So why do we need another one? The problem with already published meta-analysis is that they have used a very little number of uh, trials. Some of those previous studies have used data that are collected from patients of laparoscopic colorectal surgery only. Our study has included the largest number of randomized controlled trials, that is 29 randomized controlled trials, and we have included the patients undergoing colorectal surgeries regardless of the surgical procedure that's been used for the surgery. A PRISMA-compliant literature search was done on PubMed and Cochrane. Around 100 records were identified from PubMed search and 298 records were identified from the Cochrane, and additional 24 records were identified through other sources. All of the RCTs that met our inclusion criteria were included that were published between the September 2017 to the April 2021. We have included all of them, uh, and the all of the RCTs that compared the ERAS program with the traditional care patients hospitalized for the colorectal surgery were included. All of the papers which were full text and all the papers which were published in English language were included. So after the removal of duplicates, around 407 records were left and around 80 full texts were assessed for eligibility. So we excluded around 51 full text articles based upon their uh, because they were poor in quality. The intervention was not of our interest, and the articles were not randomized control trials. We have excluded them, and we have included around 29 randomized control trials in our study. So the results of our meta-analysis, we have conducted this meta-analysis using a Review Manager 5.4. A total of 4349 patients which were admitted for colorectal surgery were added in the analysis, with 2164 patients belonging to the ERAS group and 2185 patients belonging to the traditional groups were included in the study. And we have compared the following outcomes, that is the time to first flatus, the total length of stay in the hospital and the post-op hospital stay, the time to the mobilization of the patient, and the time to first fluid and the solid intake of the patient, the readmissions and the complications of the patients was included in the study. So in the time to Flatus, in this study, we have observed that it was shorter in the ERAS group as compared to the traditional care group as seen in the forest plot. And the total length of hospital stay and the post-op hospital stay was also shorter in the ERAS group as compared to the traditional care group. Around the weighted mean difference was around minus 3.13 as shown in the forest plot here. The time to mobilization of the patient was also shorter in the ERAS group, and this was around 16.28 weighted mean difference in the favor of the ERAS group as shown in the forest plot. So the patients actually developed tolerance earlier in the ERAS group as compared to the conventional group, and similar trends were seen in the fluid intake in the ERAS group, that the patients had a shorter time to develop tolerance to taking the fluid in the ERAS group as compared to the traditional care group. Uh, a very interesting trend was seen in the readmissions. The readmissions were actually higher in the ERAS group as compared to the traditional care group. Around 8.08% of the patients, that is 80 readmissions, were reported in the ERAS group, while 7.4%, that is 75 readmissions, were reported in the traditional care group of the study. So in the complication section, we observed that there were 32.7% complications in the traditional care group and 19.7%, that is 404 complications, were seen in the ERAS group. Uh, Following of the outcomes or the complications were compared between the ERAS and the traditional care in our meta-analysis. We actually compared the number of anastomotic leaks, the number of intestinal obstructions, the total number of post-operative ileus, the total number of surgical site infections. All of these complications showed higher rates in the traditional care group, and there was lower rate of complications that were developed in the ERAS group. So in conclusion, we have seen that the ERAS has proven to reduce the time of stay, to increase the uh, early mobility of the patient, and it is proven to speed up the recovery of the patient. Thank you.